Good morning to you all. Welcome to this episode of the Gunasheela series of patient education programs. Today we are going to be talking about Gunasheela and its legacy of 45 years. Now, I would like to tell you, I'd just like to take you through the brief history of Gunasheela. And by the way, I'm Dr. Devika Gunasheela, and with me is Dr. Jyoti Menon, who is the senior most consultant in our hospital and also the director of infertility services in the whole Gunasheela group of hospitals.
Good morning to all of you.
Yeah. Now the thing is that I want to tell you, I just want to take you through a brief history of the Gunasheela Hospital. So we come to our founders, who were Dr. Mawahalli Gunasheela and Dr. Sulochana Gunasheela. They both came from England, having finished their post-graduation degrees over there in 1965. When they came in, they joined the government hospitals. Dr. Gunasheela joined Bowring Hospital, and Dr. Sulochana Gunasheela joined Vani Vilas, and were working there as honorary consultants for some time. But their burning passion was to start their own hospital where they were in control of who they treated and how they treated and their own treatment protocols. So, with the help of money which came in from both their own earnings that they had in the respective hospitals that they were working in, as well as my father did go to America for some time and sent money in from there, my mother stayed back and built the Gunasheela Hospital. In July 1975, it was completed, and it was a long journey, a long, hard journey, because at that point of time, there were financial problems, and there were other problems, logistic problems, and finally, it came to its fruition in July 1975. At that point of time, was one of the hospitals that was actually the latest of its kind, and in the south of Bangalore, there were not many hospitals like this. It was one of its kind, and hence I think we had a large number of deliveries happening. My mother must have delivered almost half of South Bangalore, and it became very famous for its obstetric work. But then there was still a burning passion which was driving her, and she had always shown an interest in infertility, and she always wanted to go further in the branch of reproductive medicine, and hence she started to study and read about it, and kept wondering as to how she could, get the technology that was there in the West to Bangalore. At that point of time, I think we had already had, in 1978, Louis Brown, which was the world's first IVF baby, had already been born. So, having taken inspiration from the two pioneers in the world of IVF, she started to study and do her research in the same field. And Dr. Jyoti joined us in
Yeah. I joined Gunasheela in 1983, immediately post MD. And at that time, like Dr. Devika was mentioning, we were a very busy OBGYN hospital with a lot of work going on here. But as already mentioned, Madam Sulochana was always very, very interested in infertility. That was actually her driving passion. And we were already doing some amount of infertility work, almost up to the point of doing basic investigations and treating them, up to intrauterine insemination. But beyond that, her passion was to bring IVF to her patients in Bangalore. And that is why we used to go almost every Wednesday, which was her free day, to the National Dairy Institute to read a lot about IVF, because IVF by then was already very popularly being done in the veterinary science.
Yeah.
And the veterinary science, so at the end of it all, she got on board Dr. Vasant, who was by then retired as the head of the veterinary science, and also brought on board Dr. Joshua Peter, along with his student, Dr. Judith. And that is why, with all these people on board and understanding, and she had read so much about it, visited so many important centers in the world. So our new infertility wing was built in 1985, and it was one of the first 3 infertility centers in India. With the establishment of this new infertility center, we had the first baby through gift in 1988, and the first IVF baby was born in 1990.
Yeah, so that's our paper cutting of our first IVF baby. With our first IVF baby, the IVF took on,
Yes.
but then we were not getting satisfactory pregnancy rates. And by that time, we felt that we also had to kind of, build a bigger hospital, build a bigger IVF wing, because we were having patients after the birth of that was South India's first IVF baby. With that, we were getting a lot more patients, and we felt that we had to have a bigger wing. But then, because we felt also that our pregnancy rates were not coming on, we had to think a lot, and finally we found out that dust was the main culprit for our lower pregnancy rates.
Yeah, we understood that our problems in India and Bangalore were very different from what was the situation outside.
Yes.
And maybe that was the reason why we were not getting as good pregnancy rates, although scientifically we were doing everything right.
Correct. Yeah, so I think to eliminate the dust, I think Dr. Gunasheela and her team went to a few pharmaceutical laboratories and then followed the same clean room system that was there. And now we have a whole floor of this clean room. Now, this is a slightly outdated method at this point of time, because nowadays we have newfangled labs with a clean room system that is built in, which is much more compact. But this was the model that it was built in the at that point of time in 2000 and 2002, and the newer block of the hospital was inaugurated around 2000. Now the clean room system has been designed and engineered to the American FDA standard class 10K. Now there is filter air that is pushed into the lab at every point, and there's an air change that takes place 60 times an hour. So that gets rid of all the particulate matter and the dust, and our lab is now dust free, and we also get our particulate counts and done very, very frequently. As we are also an ISO recognized institution. You want to say something about that?
Yeah, so we just thought that we would get this recognition because it puts a lot of documents system in place.
Yeah.
And everybody is responsible at every level.
Yeah.
Of whoever is involved in the various processes which go on in our labs are all accountable for everything they do, because everything is documented, and we have frequent auditing by the ISO people. So everybody is very up in.
Yeah, so we got the latest accreditation.
Yeah, we got the latest accreditation also regarding that. So you can see the dramatic rise.
Yeah. After the clean room started, on the left-hand side of the slide, you have our pregnancy rates, and on the right-hand side was after the clean room, and it just went boom. Okay. Right.
I just want to emphasize here that this was not really understood earlier. That's why we are showing you this slide. Maybe now it is all, it is part of the whole system. But we took some time to understand when we realized that this is what was required to increase the pregnancy rates.
Correct. At this point of time, we must be one of the highest, one of the oldest infertility centers, which is like a private center, not in a corporate structure, and in the country. But having been the oldest and having had a legacy of 45 years, I don't think we have remained there. We have always constantly progressed, and we will show you how almost every 4 to 5 years we brought in new technology. And also I do firmly believe that we are one of the shall we say most technologically evolved institutes in the country at this point of time.
And I also want to add here, Dr. Devika, it is because continuously Dr. Sulochana before and now you read. You are updating yourselves as to what is happening in the world, and you want to bring it to patients here.
Yeah, and I think that is the right way, because it's important that whatever is there in the world, we should be able to bring it to our own population, and that has always been our passion and our motto of Gunasheela. So once we started to get our good pregnancy rates, once the clean room started, we then went on to doing IVM. Now, what does IVM stand for? IVM stands for in vitro maturation of immature oocytes. Now, what happens in a regular IVF is that we give you medication and we get the eggs which are already matured inside the body. Now, when we do an IVM, we get eggs that are immature, that are not yet matured inside the body, and we take it out of the ovaries and we mature them for 24 hours in the lab before allowing them to be fertilized with the patient's husband's sperm. So this is a technology. Again, right now we have about 600 women who have gone through this, or 600 odd women who have gone through this. And again, we most probably have the highest numbers in the country of IVM. But I must let you know,
At present, I think we are the only center in the whole country who has an active IVM program.
Correct. Yeah, right. And this technology cannot be done for everybody. This is very useful in women who have polycystic ovaries and who have had previous experiences, bad experiences with what we call as ovarian hyperstimulation syndrome, that is OHSS. And we have now got a pregnancy rate after a lot of ups and downs. We have reached a pregnancy rate, a constant pregnancy rate of about 45 to 48%, which is, I think, highly commendable.
Yeah. Just want to add a couple of things here to what Dr. Devika said, that it has been mentioned, it is not recommended for all patients. It is specifically recommended for a particular group of patients who we feel with the conventional stimulation will respond excessively.
Yeah.
So, and this we can make out by the various parameters when we do the initial investigations. And we recommend this for them. Also want to emphasize here, it is not easy to do this at every center because both technically from the clinician as well as from the embryologist point of view, it is definitely more difficult than a conventional IVF stimulation and studying in the lab.
Yeah, more demanding, more time consuming,
but it is labor intensive.
But less expensive.
From the patient point of view, less expensive, less number of days attendance to the hospital, less expensive and less chances of complications.
Yes,
convenient.
Yes, we were doing another in the days to come. We will be doing another episode on IBM itself, and I think that is important. And
we will understand it a little better.
Yeah, this series is mainly directed towards patients rather than doctors. I mean, it's for patient education. So we did that, and we got our first baby in 2003. And then we were going on quite okay, and then we discovered young women and men who had cancer, and in the world they were preserving their eggs, they were preserving their ovarian tissue, and in women who were married they were taking out the eggs from them, and they were fertilizing it with their husband's sperm and preserving the embryos. And this is something that we want to bring again to India. And why we do this is because when somebody is diagnosed with cancer, the next options would be either surgery, or they would have to undergo surgery, after which radiotherapy and chemotherapy, or they would undergo surgery and chemo, or just chemo alone. Now,
and also by that time, we also understood that even in India, the cancer treatment had become extremely effective.
Yeah.
And we were getting many more young survivors who had to look at the options beyond survival.
Correct.
And fertility was what they were all looking at. And that's why we thought that we will help them by doing this.
Yeah. So at that point of time, Dr. Gunasheela and I went to Germany, and we attended a few conferences, came back and read a lot about it. And we also understood that the various forms of cancer treatment does affect fertility. And what happens, especially when you have chemo, and depending upon the chemotherapeutic drugs, it can either decrease the sperm production or the egg production in the woman. And hence we decided that we would like to start a program which was going to be completely a charitable one at that point of time. And hence Gunasheela Institute of Research in Cancer and Fertility was started in 2010, and with the main aim of preserving fertility for these young men and women who are undergoing cancer treatment before they underwent either the chemotherapy or before they underwent radiotherapy, so that in case they lost their fertility after the cancer treatment, we could always help them with their stored eggs and sperm or embryos. We also started to store ovarian tissue, which was at that point of time path-breaking. Yeah. And until now, we have stored about, shall we say, about 400 odd men. We've stored their sperm, and for about 36, 37 women, we have stored the various combinations of eggs, embryos, and ovarian tissue.
By this time, we realized that the patient profile of those who are coming to Gunasheela seeking infertility treatment had changed, because many centers had come up in Bangalore, and they had gone to their nearby centers. They were very distressed because 1 or 2 IVFs had already failed. And we sat and thought, okay, now how are we going to help them conceive when they come to us, which could be have been the second cycle or the third cycle.
I just want to add over here, but at until when I came back in 2000, I think there were only 2 centers in the whole
Yes,
of Karnataka,
Karnataka.
with ours being one of them. And by the time it came to 2012,
12 years,
we had at least about some 7, 8 centers that had sprung up
by that time.
by that time. And now I think in 2020, I think we have about 160 IVF clinics and something like about 80 to 90 IVF labs in Bangalore alone. We're talking about Bangalore alone. And so God knows how many are there in Karnataka. But then that's the way the exponential rise
in the centers.
Yeah.
So then we just thought that, okay, let us try see if there is something which is available, which will help us increase the pregnancy rates for this particular group of patients
who had
repeated IVF failures. Yeah. So, and then that is how we got our first embryoscope, which is a time-lapse monitor. In very simple words, this is a specialized incubator which has an inbuilt camera, and this takes images of the growing embryos at preset intervals. So, and this is all displayed on a monitor which is on the outside of the incubator. So the embryologist just sitting there can monitor the embryo growth. It's not required for the embryos to be visualized by the embryologist at regular intervals in order to assess their growth, because frequent closing and opening of the incubator causes a change in pH and temperature, and so the micro environment in which the embryos have to grow can be disturbed, and this takes care of that particular problem. And we were able to see that we were definitely getting some amount of increase in pregnancy rates in this particular group of patients when we recommended that they use the embryoscope as part of their IVF treatment with us.
Yeah, we had the first babies through embryoscope. They were a set of twins. I think it was a lady from Andhra, and that is it. In February 2013, that was the first in South India.
By this time, in September 2012, my mentor, Dr. Sulochana Madam, passed away. But the spirit of Gunasheela, with the never say die spirit of Gunasheela, and the passion to bring the latest technology for the benefit of patients who come to our hospital has continued even with Dr. Devika. And that has never changed. And that is the reason we continue to bring in new technology.
And one thing is to bring in technology. The other thing is to be able to use it in the right way.
Yeah, it's for definite group of patients. Like we were telling you all about the embryoscope also. We are not going to recommend it for everybody.
Yes.
And that is again the reason is because we are getting different kinds of patients, not many more of repeat IVF failures.
Yeah, see, now what has happened is because we have so many labs, and I think if you drive around Bangalore itself, you will have a lab or a center IVF clinic or something in every small road. Our patient profile has changed, and now we've become like more like a tertiary referral center for women who have problems. Seeing women who have had like 6 or 7 or even 8 miscarriages, IVF failures 8 times, 9 times, that has become quite the commonplace for us. And our patient profile has completely changed from, just straightforward first time IVF patients. Of course, we get those type of patients, but then we get a larger number of patients who have failed, who have more problems, who have had repeated miscarriages, a lot of problems with their partners, the male factors and things like that. And we were also getting women who were much older age group. So to help out these women, again, in the whole world, there were PGS was coming up, and of course, even now, the technology of pre-implantation genetic screening is still controversial. There are many people for it, and just as many people against it. So it is still, the technology and the opinions about it is, shall we say, still evolving, but nobody has stopped doing it because some set of people think they shouldn't do it, or set of people think that they should do it. And that was the reason that we brought in our in-house genetics lab with the facilities for chromosomal screening, karyotyping, pre-implantation genetic screening for women women who were, older than 40, women who have had recurrent miscarriages, recurrent implantation failures, and
so a specific group of
yeah,
patients,
specific
not
group,
for
yeah,
everybody.
not for everybody. We don't recommend it for everybody because it is also not recommended for everybody, and it also decreases the time to pregnancy. Yeah. So what we normally do is, we have PGS technology. We grow the embryo up to day 5, which is called as the blastocyst stage, and then we take a few cells from this embryo, which doesn't really hurt the embryo, because that is a question that I get commonly asked. It doesn't produce any damage to the embryo. I mean, because we make a small opening in the shell of the embryo and allow the cells to grow out, and then we analyze these cells, and then we try to see whether the embryo is chromosomally normal or not. Again, there are lots of pros and cons to this whole thing, which is out beyond the scope of this presentation. But then we have progress in that way, and we have been getting plenty of pregnancies. But one should realize that PGS is not an elixir. It is not that if you have a chromosomally normal embryo that is going to 100% produce a live baby. You can still have miscarriages, you can still have failures, but a lot of them do end up conceiving and taking a baby home.
Okay, so the advantages Dr. Devika has told you. What is special about our unit is because since we have the in-house technology, if the patient desires, we can do the transfer in the same cycle.
Yeah, correct.
And that is if they are wanting a fresh cycle transfer. If they want a frozen embryos, which they have frozen earlier, before this technology was available, we can still thaw those embryos. Means they've been frozen, so you thaw them, and then you do the biopsy, and then the best of those embryos, within 24 hours, we get the result and we transfer. And in fact, our first baby came through that.
Correct. Yes, exactly. Then now our latest acquisition is our radio frequency identification technology. It's called as RFID system.
And I just want to add here that we have always had double witnessing because we have in-house embryologists who stay with us, and we've had at any time more than 2-3.
Yeah.
Okay, and at present we are 8. So that is the reason why we are able to do this double witnessing from before, and it is part of our ISO also. Correct. That is also there. But we wanted to, I'm sure all of you have seen that movie Good News. So we just wanted to have one more level of making sure.
Yes, okay. Yeah, correct. And I think that it is very important for the patient to understand, because again, this is a very common question asked to us by patients saying, are you sure it's going to be my own sperm? Are you sure it's going to be my own egg? And until now, like Dr. Jyoti has been saying, that we have always had double witnessing. So what double witnessing is, when suppose I'm doing a procedure, Dr. Jyoti is going to be looking at it and inspecting it, and also both of us sign off saying that this has been done with the same person, the same couple's gametes, and this is the same dish, and the labeling has been okay, etc., etc. Whatever checkpoints have to be done and followed in the lab, they are done, and both of us sign off against it.
So the embryologists are accountable at every step which they go.
So one of the common questions is that, are we using our own gametes? And to allay these fears, we thought that, bringing in a pretty foolproof method, so that the patient also gets a bit more convinced, and also the patient has a lot of, peace of mind that we brought in this technology. And this is where it is all the dishes that are used by the patient, her own eggs, her husband's sperm, her embryos are all tagged with this RFID labeling, and it is transferred to a computer, and you can get the whole statistics in one shot. And if there is no scope for a mismatch to ever happen. So that is another layer of security that we have brought in for our patients, just to be absolutely on the safe side. It is for your safety, and it is our double safety. We still have not done away with the double witnessing. Our embryologists use this, and they use the double witnessing as well. So we have a 2-layer safety.
Just very briefly summarizing what all Gunasheela has achieved. First IVF baby in South India was in 88, which was by gift. Then the IVF happened in 1990. IVM baby, the first baby was in 2003. That's the IVM baby in India. First IVF baby. And 2011, you can tell us them about that vitrification of
Oh
IVF
yes,
oocytes.
yeah. We took it to the next level where we had immature oocytes that were taken out, matured, and they were frozen. And what happened was that the patient came back and claimed those oocytes, and then we had to take out these oocytes which were actually previously immature, then matured, then frozen, then thawed, and then they were injected with the husband's sperm, and then that resulted in we put that embryo back, and then that resulted in in a pregnancy which she delivered, and that was the fourth in the world.
Yeah, in 2011 it was the fourth. So
Yeah,
that is
yeah,
another huge achievement for us.
yeah.
Then, of course, the first embryo scope babies, which were twins, were in South India, was born in 2012.
Yeah.
2016, we had our first PGS babies.
With our in-house technology, we have the latest, the new generation sequencing.
We have that also. That is another thing we have.
Yeah.
A new generation sequencing as the technology. And then in 2020, we had the we have introduced the RFID technology.
Yeah.
So this is how we have gone at every level, every couple of years, trying to do better for the patients and trying to bring to our center whatever is available in the world at affordable prices.
Yes, and also
I think that is important.
Yeah, and I think we also should tell them that Gunasheela has a history of first. We were the first ones to bring in ultrasound into Karnataka, and ultrasound is right now a situation where you can't, no obstetric clinic or no gynae clinic will do without an ultrasound, no diagnostic centers without an ultrasound, and we were the first ones to bring it in at that point of time.
Correct, and even lab sterilization.
Yes, lab sterilization.
Sulochana madam was doing.
Yeah, she did mega camps, and then she taught a lot of the corporation doctors, etc., to do it. And also, first to bring in laparoscopy, first to bring in hysteroscopy.
That's ultrasound.
Yeah. So
So we had a lot before the IVF, and then the IVF came.
Yeah.
So then now we have introduced this academic wing in 2016, and we conduct various conferences and CMEs. We are also associated with the JSS University, where we have a 2-year MSc embryology course. For clinicians also, we are conducting 6 months and 1-year course fellowship in reproductive medicine.
We also associated with Rajiv Gandhi Health University
for the courses in fellowship in reproductive medicine.
Yeah, yeah. And so we're just going to kind of coming to the end of it. We don't want to bore you too much. These are our success rates, and
with IUI we get about 23%. This is 2019 over the whole year. When we do an IVM, it goes to about 40%. When we do the conventional IVF, it's going to about 55%, and our frozen embryo transfer, like anywhere, like it is having a very good success rate. It's about 71%. Now, these are our 3 centers. The first one, of course, was Pasvangudi. The second one was Mysore, I think, in 2011.
Yeah.
And then we got our Koramangala center up and running in 2015.
Yes, correct.
And now we've entered Maharashtra, Pune, in 2019. Unfortunately, we had 2 cases which we just did, and then we had to close because of the COVID lockdown. But we want to share with you that both the cases, which we must have done about 4. We've done about 4. Out of we transferred only for 2 patients. And everybody is good luck, including the patients. Both have become pregnant.
And we only started it in January, and we had to close down in February because of this, thanks to Corona. So the COVID-19 crisis. So, but anyway, when we open, I think we're opening on June 1st. So hopefully we should, start off something. So we just want to kind of educate people as to what they should actually look for, because like now there are 90 or something odd labs. So what exactly should they look for when you're choosing an IVF unit? It's a consumer's market. It's become a business. So what exactly should one look at?
See, in my opinion, because I've been around here for a long time, and what the patient seriously should look at is a couple of things. One is definitely, how long has that IVF center been in existence? What is the experience of the clinicians? And like I had already mentioned, we have in-house embryologists, and I feel that is extremely important for 2 reasons. Patient safety, one thing. Secondly, for keeping all the very critical equipments in the lab, they are continuously require maintenance. And you have to troubleshoot them. During the procedure, you can't go and say, oh, this is a problem, that's not working, this is not working. And if you don't have in-house embryologists, you cannot have that kind of care inside the inside the embryology lab too much. I also believe that you should have the IVF program up and running throughout the month, because that is when you will be giving the best possible treatment to any patient who comes to your center. I believe that when you do the batch IVF, you're trying to adjust the stimulation protocols so that the egg pickups will happen during the particular time, and you will finish the embryo transfer during that particular time.
So
Your lab is only open during that time, and the embryos are available during that
so
time.
you kind of put in day 2 embryos, you put in day 3, you put in day 4, day 5, you put in whatever embryos at whatever stage.
Because your lab is going to close.
Yeah, correct. Yeah.
It is not because of what is best for the patient. This has been my opinion on the batch IVF.
But having said that, people still do batch IVF, and it does work to some extent, but it may not be the ideal situation. Yeah, we're not saying that it doesn't work. It does work to some extent, but it would be definitely a better option to do a continuous stimulation.
Correct. And then you keep your program going on the whole month.
Yeah.
And even the patient doesn't have to adjust everything or adjust her periods according to what is the possible egg pickup or this thing date, because that center is not going to work for the next 15 days or whatever.
Correct.
Anyway, there are pros and cons of both. We are happy doing the continuous program going on throughout the month, which has been happening from the time the IVF unit has started, and we will continue to do that. So that is how it is, and you should definitely look at their results, and we are very, very transparent. We put up our results both for IUI and IVF.
Yes.
We update them regularly. So I feel the patient should look at all these factors before they choose an IVF center.
Right.
And not only how close it is to you, to your house, and is it a little cheaper than going to another center? Yes, that is a factor. Economics is a factor, but that should not be the only consideration.
And we're talking about this in general. It applies to all labs. If you're looking at only one or two factors while choosing your IVF lab, it is quite likely that you may end up not getting a pregnancy and having to again do a repeat IVF, which is again only going to double the cost, isn't it? Economically, financially, it doesn't make sense. So now going back to how are we dealing with our patients in this COVID crisis?
I'm sure this is a concern for all of you also.
Yeah.
And so we put our heads together and said, okay, what is the best way we can deal with this so that we are safe and you all are also safe?
Yeah, actually speaking, our hospital doesn't deal with these medical patients, and I'm talking about medical patients. I'm talking about patients who have, fever, who come and see a physician, fever, sore throat, breathlessness, cough, etc. We don't have those kind of patients here. We are mainly dealing with men and women who have surgical problems, or men and women who have infertility problems, or women who are actually pregnant and who are delivering, or gynae problems. So that's the basic thing that we're dealing with. So if you look at our hospital, I think our patients coming to our hospital are in a confined lot. It's not a general multi-specialty hospital type of a setting. So what we do is we do first a triage as soon as you come in, and then we see, and all the patients who come to us have to download the Arogya Setu app, and then we will do a system of risk assessment, and then we see where they're coming from. If they're coming from containment areas, they have to go through a different procedure. If they're moderate and low risk, we've created a special labor ward for them and a special examination room with a different set of doctors and nurses who will look after them. And if they're low risk, they come into the main hospital. So there are a lot of procedures and safety measures that have been taken. And I think as of now, we've been pretty good and pretty okay with that.
All of us are at every level, especially right from the front office people, the nurses, everybody is in PPEs.
Yeah, everybody is in PPEs. You have the thermal scanning going on. You have a lot of measures.
Sanitizers available everywhere.
Yeah.
So whatever, though like Dr. Devika said, we are a low risk unit for COVID, because we do not get that group of patients, but then we are taking all the precautions because we don't even want to give you that 1% chance.
Yeah.
So from our side, whatever is possible from the hospital side, we are taking all the precautions to prevent. And we want you also to be equally safe and take whatever precautions before you come to our hospital.
Yeah, so I think we've given them a gist
Yeah,
of what
whatever
is
is.
happening in our hospital and our history. And I think it was important because
Yeah.
this is one of the oldest IVF centers in the country. And I hope
We just
you've,
wanted you to know what is available in our center
yeah,
and which is a little different from other centers
yeah,
and how it could possibly benefit you.
yeah.
You make the choice.
Yeah. So thank you very much for watching, and we'll be back with our patients education
Yeah,
series. Like I said, it is mainly for patients, it is not for doctors. And if you have any queries about it, you can always write to gunasheelaivf@gmail.com,
or
or
ask.
we will write it up, we
Yeah,
will add it up at the
in the
bottom as
bottom.
to where you can send your queries to.
Yeah,
We'll be happy to answer them. So stay home, stay safe, and thank you very much for
yeah.
watching.
Thank you. Stay safe.